So renal artery stenosis, very important pathologies. We have kept this first. So causes of renal artery stenosis, always remember there are two important. One is atherosclerosis, which is by far the most common. And then there is your FMD wala spectrum or vasculitis, things like that. So atherosclerosis will be in older, male population mein zyada hoga. It will affect the proximal segment, just like we saw in the case, proximal segment. Whereas FMD will be more prevalent in young Asian females affected. Now again, this can be in males also. ठीक है, बट इन जनरल अगर कोई बात करता है कि एफएमडी, तो फिर प्रेवलेंस वाइज यू कैन से कि अच्छा यंग एशियन फीमेल में if I'm getting uncontrolled hypertension, then I have to always think of FMD. However, if I talk about in general the whole population, the cases of atherosclerosis will be far more than the rarer things like FMD or vasculitis, affecting the mid to distal segments. Okay? Diagnostic criteria, as we discussed, there is something called as the direct signs, which you're getting in the main renal artery. A PSV greater than 200. So this is like an absolute criteria. I told you that 150 is the upper limit. So if it is coming like 180, then you have to be very suspicious. And the moment it crosses 200, so it's like 100% sure that there is something abnormal. There is some kind of narrowing or stenosis which is going on. So more than 200 centimeter per second. Renal to aortic ratio, the PSV of renal artery divided by the PSV of the aorta, if it is exceeding more than 3.5.